I'm Cecelia Boardman, and I'm a GYN oncologist here at Sarah Cannon. I've been in practice 18 years. I'm a GYN oncologist because I love the concept of total control of the patient, being able to provide everything that the patient needs, from diagnosis to surgery to chemotherapy to long-term follow-up care. One of my mottos is, you don't succeed unless you try. And I have a patient who presented with a very advanced, very aggressive cervical cancer and truly looked like she had maybe days to weeks to live. And we took on that challenge and gave her very aggressive chemotherapy. And 4 years later, she's cured. We've had some amazing advances in gynecologic cancers over the past decade. I think from a surgical perspective, one of the things that has really changed what we do for patients is robotic surgery. Patients are able to receive the same operation through smaller incisions, and that translates into a faster recovery and a better overall operative experience. So definitely robotics from a surgery perspective has been phenomenal. From a chemotherapy and treatment perspective, we have seen some pretty significant advances in the past few years in terms of new treatments for women with gynecologic cancers, including immunotherapies and biological therapies and targeted therapies. And so it's really changing the face of what we do and giving patients a lot more hope than they had a decade ago. From a patient's perspective, being able to have a surgical experience where they only have 5 small incisions instead of 1 large incision has been, I think, a tremendous advance. The robotic instruments themselves have amazing dexterity, and we're able to work in very small spaces in a very precise way. We're very excited about our partnership with Sarah Cannon. Our journey really began probably about 1.5 years ago, and one of the things that we've really brought to our patient care here at HCA in Richmond has been advances in terms of an enhanced recovery after surgery process, or otherwise known as ERAS. And what that involves is trying to focus on using less narcotic pain medication through the course of surgery, trying to maintain the patient's bodily functions at a normal level during surgery so that the recovery process is shorter and faster and easier. We're also working with Sarah Cannon to develop pathways to optimize patient care experiences from diagnosis to treatment for women with uterine cancer and cervical cancer. It's been a very productive partnership already, and we're very excited about the future. I stay motivated to do what I do because I love what I do. I love the patients, I love the people that we work with, I love the combination of surgery and office-based practice. It keeps it exciting and different every day, and keeps us motivated.